Hello, class. Week 7. Um, Considering all the symptoms that we've gone through up until now, homeostasis, metabolism, triglycerides, um, the DNA, the abnormal oxidation, plasma and tissue enzymes activities, uh, the hair loss, the cortisol, the bone loss, memory loss, glutamate, atrophy, fibromyalgia, and the symptoms we just went over in week 6 with substance P, considering all these things, and with the symptoms that's presented now, um, hyper, um, I'm so sorry, um, hypersensitive retinopathy. Um, One of the questions is it associated with increased catamine production of the adrenal gland and arrhythmia and high blood pressure? Are all these intermittent and high resting heart rate? Are these associated with um, increased catamine? And I would say yes. Hypertensive heart rate, intermittent arrhythmia, and high blood pressure are all associated with the increase of catamine. Um, the adrenal medulla secretes catamine, um, epinephrine, or norepinephrine, and dopamine. According to Oxford Academic and the British Medical Bulletin, hypertensive retinopathy has long been regarded as a risk indicator of systemic morbidity and mortality. Base studies show that hypertensive retinopathy signs are strongly associated with blood pressure, uh, but inconsistently associated with cholesterol and other risk factors of arteriosclerosis. This data supports the concept that an assessment of retinovascular changes may provide further information for vascular risk stratification in persons with hypertension. However, cardiovascular disease is a trigger for all or most of the previous symptoms, such as diabetes, obesity, high blood pressure, high cholesterol, hypertensive retinopathy is the most common ocular manifestation of hypertension. Arterial oscillation and ocular ischemia syndrome, which are often associated with cardiac and carotid disease, can also result from hypertension. Metabolic syndrome is a group of risk factors that raises risk of heart disease, diabetes, stroke, and other health problems. It is diagnosed whenever any of the three mentioned symptoms um, are present. So, um, cardiovascular disease is the disease that I have chosen when the arterioles that supply blood to the heart muscles become hardened and narrow. This is due to the mild buildup of cholesterol and plaque on their thinner walls. This buildup is called arteriosclerosis. As it grows less, blood flows through the arteries. As a result, the heart muscle can't get the blood or oxygen it needs. This leads to angina or heart attack. Over time, cardiovascular disease can also weaken the heart muscles and contribute to heart failure, arrhythmias. Heart failure means that the heart can't pump blood well to the rest of the body. Thank you. Sorry that I went over. It was a lot of information.